Thank you, everyone. Thank you so much again for spending time with us today. Again, we are excited to have an honor to have Wadbutt join us to share his experience at United Healthcare and trends he's seeing in the healthcare space. So thank you so much, Fawad. Today we're going to focus on two focus areas: the demand and increase of telemedicine and the rise of RPM, remote patient monitoring. So Fawad, we understand that telemedicine is growing and has increased by 65% this year. I mean, patient adoption at the beginning of 2020 was up 33%. And McKinsey reports are stating that virtual visits could potentially account for 250 billion in healthcare spending in the coming years. How does this impact payers, providers, and pharma, and where do you see the gaps currently?
Yeah, Alex, first of all, thank you for the opportunity. Super excited to be here and listen to some of the startups that are going to be presenting. I think, as you mentioned, the telehealth and telemedicine and remote patient monitoring markets are really expanding and have been for the last few years. But this year, especially because of COVID, I think this transformation, this journey has come up by a number of years. And as you can imagine, there's a typical flow to how patients and physicians interact. And that's been going on for a number of years. But with the restrictions and the challenges that came with COVID, both for patients as well as for providers and healthcare ecosystems and hospitals, it became very difficult to take on that additional workload, make sure that they were protecting and delivering care to the COVID patients while continuing to manage the populations that were typically there. So we're seeing a tremendous amount of uptick, as you can imagine, in this space. This market is growing in some respects by, in a logarithmic fashion. What we've seen is that whereas patients and clinicians were usually using technology as a secondary or a tertiary mechanism to engage and to collect data, that's really shifted. It's shifted to a point where I think partially because they didn't have a choice, and partially what's starting to happen is that as people have adopted this out of necessity, they're finding the usability, they're finding that there's a lot of mechanisms that they were leaving on the table in the past. So we're seeing a lot of demand growth. We're seeing a lot of adoption in this space. And in some areas, we've seen this go up by 3, 4, 5, 600% within the course of last 6 months. So definitely a growing market, Alex.
Wow, that's definitely interesting, and thank you for sharing all those insights there. With the rise of, with the increase of telemedicine, definitely comes with remote patient monitoring. It comes with all these devices that can grab data to inform these physicians on when to intervene and modify the treatment plans to have the best patient outcome. We've seen this work with platforms like Livongo, Teladoc acquiring Livongo recently, right? So, what kind of trends have you seen in the RPM space, and can you share any kind of use case studies that United Healthcare has done as well?
Yeah, I mean, I would say remote patient monitoring, I think is really a sustainable market, which is going to be here and it's going to continue to grow. We've seen this grow, in a significant way, especially as it relates to chronic conditions. People that have diabetes, people and patients that have, sort of heart conditions and other type of chronic conditions, where it's not about an event that day or that week. It's more about trends and how people are adhering to protocols as well as sort of managing their long-term health is where remote patient monitoring is coming in. One of the areas which is pretty typical where I've seen a tremendous amount of adoption is on the glucometer side of the house, right? Where people have these devices like these Dexcom devices where you use to check your blood sugar levels and your glucose levels. I mean, that's an area where people would have to sort of do that testing in home. They would have to put it in a notepad, and the next time they went to see their physician, they could sort of share that data with them. And what we're seeing is that while that's useful, I think what's becoming more useful is to have that real-time connectivity with the patients and to have that continuous availability of that data. Now, the other reason I think this market and this use case is growing significantly, and you'll see others come around, right? Whether it's around heart care, whether it's cardiac care, whether it's hypertension and other sort of chronic diseases, is that from a clinician standpoint, from a health system standpoint, it's interesting to have this data, but it's more interesting to have reliable data. And what I mean by that is that you could buy a lot of devices. In the last 3-4 years, you could buy Fitbits and you can buy Apple Watches and you can buy other devices that kind of give you, some sense of your basic vitals. While those are good, those aren't really actionable in many ways for the healthcare ecosystem, because the quality of data they produce isn't as high as a clinical grade device, right? So imagine yourself in that setting, and you're a participant in the healthcare ecosystem, whether you're an insurance company or you're a provider of these services. You definitely want to make sure that if you're going to make a decision based on a set of data that you're receiving, that it's reliable data. So I think one of the things that I will tell startups and others that are sort of coming into this space and expanding into this space is that while it's interesting to get a lot of data points, it's really important to make sure that you can show that these are decisionable sets of data. Right, this is something that a healthcare provider can actually use and be able to make a decision and then not feel unprotected, because there's insurance issues, there are regulatory issues, there are a lot of compliance issues that come in with that. So we see use cases in these chronic diseases for remote patient monitoring continuing to grow, and I think we're going to see that continue to evolve. But I think where I've seen a little bit of a disconnect is while a lot of startups are starting to say, hey, we can do something with this data, the data collection part itself is sometimes very unreliable.
Gotcha. And, so talking about the data, collection and how it's being unreliable, I understand recently, United Healthcare just made an acquisition in an RPM company called Vivify Health. At the time, they just had raised 24 million. United Healthcare being the largest healthcare company by revenue, bringing in 242 billion, last year. What made Vivify Health, so appealing, and what validated them on their data collection for you guys to make that acquisition?
Yeah, I mean, I think Vivify, and there are a couple other players out there that have done a really good job of understanding that the reliability of data comes first, and then all the clinical pathways come second, right? And one of the things that Vivify and others have done, a couple others, is that they sort of started with building a data platform first, right? So they sort of thought of themselves as an aggregator of IoT device data. So if you think about it, right, these devices that we're talking about, in many cases, they're kind of like any other IoT device, right? This is these are devices that have some very consistent behavior, and what I mean by that is these are reliable devices made by third-party organizations. These devices are very chatty, meaning that they push a lot of data out. This is not like, hey, an update every hour or an update every day. In many cases, they're sending out updates every second or millisecond or multi-second, depending on what the situation is. So I think companies that are looking to penetrate this space and are thinking about the data first approach will probably have a little bit of a leg up longer term, right? Because if you start with the healthcare use case, I think that's one approach to come at it and try to solve the problem. But I think the question of reliability is going to come up over and over again if you come from that angle. I think if you come from an angle to say, hey, we're aggregating data and we want to make sure that we can deal with the velocity, we can deal with the variety, we can deal with the reliability of this data, I think that's where large-scale organizations will be more attracted to either acquiring or partnering with these kind of organizations because they're looking for reliable outputs. And if you have a data-first approach where you can not only just say, hey, we can deal with these millions of interactions that are coming from hundreds of thousands of patients, but we can also reliably tell you that this data set is accurate. I think that's where the value starts to come in. Now, the use cases have to be there, right? I mean, you have to have a point of view on what market segment you're solving for. How do you differentiate? What can you do beyond just giving a physician or a health system basic information? Can you sort of do some analytics on it and say, hey, this is what we see the trend going towards? Or can you share some insight? So data reliability is very, very important. But the funny thing is, the intelligence on that data is perhaps the most useful thing for both the patients and the clinicians. So it's important to build that foundation, but then not to forget about the use cases and the usability that sits on top.
Gotcha. And what do you think would be like, how can startups prep themselves, for, when they go out to payers, what can they do to help make that, validation process a lot easier, for payers like yourselves in order to, utilize their solutions?
Yeah, I think, look, what startups have is, they have innovation, they have new ideas, they have agility, and they're trying to solve new problems. What they don't have are customers, right? They don't have a brand. They don't have access to data, that sometimes they need. So I think those partnerships obviously make a lot of sense. But to be able to make those partnerships attractive, I think there are a few things that you got to be able to bring to the table. One we talked about, which is the reliability of the solution and especially the data that you're bringing in. I think the other thing is that you got to figure out who your customer is within the health ecosystem, right? And I think sometimes people come up with ideas that can have many customers, but they don't identify the specific customer. So I'll give you an example, right? So if you're doing remote patient monitoring, are you aware of what the Medicaid rules are related to remote patient monitoring? Do you understand what Medicare requires? Do you understand what commercial grade insurance requires? So even the same solution could take a lot of different lenses depending on the line of business that you're going after. So one of the advice that I do give startups is that as you're starting to build these kind of solutions, also think about the customer and who that is, and not just, hey, my customer is going to be a large health insurer. Within that health insurer, which line of business is going to be your customer and why? And then tie the benefits back to them, right? So there's some new regulation, for example, that's coming in called interoperability, which is going to impact some of these segments. And these are rules coming from the government, which are going to force payers and providers to share their data across the ecosystem. As part of that journey, for example, Medicare and Medicaid may have much higher adoption based on some of the regulatory framework that's being put in. So if you're building a solution and you have this support from regulation coming in, then you may want to just sort of pivot to that market first, right? Because that's an area where somebody's going to be looking for solutions. That's where payers are going to be looking for solutions. So part of this is really the technology and the science, and part of this is really looking at the macroeconomic trends, and especially the government regulation that's kicking in, and trying to figure out how you can build that solution that's not only just useful for customers or consumers, but also for the entities that are going to deliver to the consumers, like payers and providers.
Thank you, Fawad. And I mean, it looks like they have a lot of good amount of prep work to do, and I think you shared some good insights on what they're looking for. Now let's switch this back to payers that are trying to review startups. When it comes to implementation or figuring out specific metrics for a POC, what are the best practices that you can share to make sure the innovation process is as smooth as possible?
Yeah, so I mean, look, over the course of my years, I've worked at Kaiser Permanente, I've spent time at United Health Group, and we get calls from all sorts of startups wanting to, sort of bring their solution to the table. And a lot of times what we find is that they have a really, really good set of ideas, and they've built some really good technology. But the question for us in many cases comes in two areas. One is this a viable company? How far along are they in the process to be able to leverage this technology platform? And the second thing is, are this solving a specific problem? Sometimes what we see as a challenge is that companies will come in with broad sets of solutions, but they don't have a specific area that they're trying to solve for. And I think that that specificity will help you get in much faster than trying to say we can disrupt all aspects of it, or 5 different things that we can solve for. We can solve for your regulatory thing, and we can solve for your patient monitoring, and we can do a telehealth platform, and we can do scheduling. Instead of sort of doing 5 or 4 or 3 or 2 different things, try to figure out that one thing that you can do really well, and then come to the right customer base within the payer environment and connect with them. And I'll tell you, more often than not, people try to go after the commercial business because that's the largest, higher margin business. But what I will say to you is, in most cases, the Medicare and the Medicaid business have a lot more needs and demands, even though that's not the highest margin business. So segment your target audience and have a very specific solution within that segment as the first area of adoption or outreach. And then as you make some POC progress in those, and you're more likely to get that response back to say, hey, this is interesting. It's not going to take a whole lot. This is something that we are trying to solve anyways. Let's try to bring it in. And then add layers in terms of what else you want to do with your platform or your technology.
Awesome. As startups and, large hospital corporations like, United Healthcare or big pharma companies are trying to, validate solutions in the RPM and telemedicine space, let's bring it back to like providers, in order for them to adopt new services, a lot of it correlates with, medical billing.
Yep.
How do you think, these RPM data points are going to tie into the medical billing process for the providers? Because it's going to be hard for them to offer this type of service if they're not going to get reimbursed on it. What are trends or, advice you can, give in that sense?
I think, look, what I'll say first is that providers are kind of getting squeezed from all angles, right? I mean, they're getting squeezed from health insurance organizations in terms of their payments are being cut in many ways. They're dealing with increasing regulation and patient care protocols that's taking a lot of time for them to see those patients. And they're seeing, they truly, if you talk to provider organizations or providers in general, what they'll tell you is that they feel like they're getting squeezed from both ends. So I think if you're in that situation, you're definitely interested in things that can solve for those 2 problems. How can I get better payment and more reliable payments from the insurance entities? And how can I engage with my customers to simplify the workflow or do some of the workflow before the patient shows up in my office so I don't have to do the repetitive work at a very expensive time? So I would say the providers, are interesting places to go to help solve these problems, but I've seen difficulty in getting adoption at that level because a lot of these folks are really they just don't have the time or the capacity to do it. Now, what you do want to do sometimes is find these larger groups and organizations where there's 1,000 providers or 500 providers or 2,000 providers have come together to build an association or an entity. I think there you're going to have a much better opportunity to bring these kind of solutions to the table. Versus if you go after smaller providers, I mean, those guys are just so swamped that they'll give you some advice, they'll be able to give you some input, but I don't know if they're going to be really customers unless you're solving for something very, very unique which typically I haven't seen out in the marketplace.
Gotcha. And, with like, providers trying to figure out how to, bill for this, we understand that like there's about 3 to 4 CPT codes out in the market right now that payers are reimbursing on. And just by enabling our providers to monitor vital signs remotely and get paid, on average of $210 a month, to achieve on each patient, to achieve value-based care versus, fee for service. I mean, what are your thoughts on, that trend? Do you think this is going to enable our providers and increase better outcomes, with, a preventative approach, or, or otherwise? Yeah.
Well, I think the science is very clear on it, right? I mean, if you wait for a patient to show up to your office, you've already lost the battle, right? I mean, I think the reality is that what you do or do not do on the 364 days that you're not in the hospital or you're not in front of your provider is probably more impactful on your health in many ways than the time you show up. So I think there's really real tremendous value in giving these kind of services to patients for just better health outcomes. It reduces readmission rates. It provides a lot of interesting, sort of insights into patient behavior, which can then be used to guide patients on the right path. I think there is a little bit of friction today. As you mentioned, there are some CPT codes, but I don't think 3 are plenty. I think there's so many different mechanisms for doing this kind of monitoring that we're going to need a lot more CPT codes. And I'll bring it back to where I started, which is I think because of COVID, because of all of these factors where people are not necessarily able to go to the physician as often as they have been, I think I'm starting to see a lot of push in Washington and in these regulatory bodies and some of these organizations that decide these payments to add a lot more of these codes. So I suspect over the next 12 and 24 months, you'll see an additional number of CPT codes that will be added so that providers and payers can charge for more of these services. Because at the end of the day, it really does help the overall ecosystem. It does help that patient and member live a much better life if we have a sense of dealing with their problems before they show up to the hospital or the emergency room.
Yeah, thank you for your feedback and answer there, Fawad. So it looks like we need to move on to our Q&A portion. So we have several questions here from our audience. Looks like the first question we have here is, can you specify which area there has been a 300 to 500% increase in telehealth?
Yeah, so we're seeing it in a couple of different areas, right? One is just the most basic of services, right? So I would say, where people used to just sort of show up to a physician to get a refill, or, hey, I'm not feeling too well, or I need some sort of non-emergency sort of care. I think in those areas, because the providers and we're so caught up with dealing with COVID, and the protocols were sort of unclear on who can go to the hospital versus not, I think we're seeing a lot of demand there. In companies like Lemonade Health and others that have developed these workflows that allow you to sort of deal with these kind of questions online and then be able to get care, I think those folks are going to see, those are the areas where you're seeing that kind of demand and growth come in. So the most basic services, I need a smoking cessation medicine. I have some refills. I need some hair loss medicine, or I need some sort of, sexual health related medication or advice. I think those are areas which are easy to automate. And I think that's an area where people are getting a lot more comfortable with dealing with a screen versus seeing a physician face to face.
Thank you. Next question is the authenticity of the data in RPM critical, or do you see a potential for fraud in data collection?
I mean, today, if you go with some of the reliable organizations, you do the analysis and make sure that the data is of high fidelity. I mean, if it's not, then fraud is not what I'm worried about, right? What I'm really worried about is and what the ecosystem is really worried about is making a decision based on a data set that comes your way that turns out to be the wrong decision for the patient, right? Or losing, sort of think of it, it's a double-edged sword. One is that if you get bad data and you make a decision and that decision happens to be the wrong decision for care, that's a bad outcome, obviously. The flip side is that you lose, you say, hey, this data generally isn't good, and an event happens and you don't make a decision based on it because you think the data is always unreliable. And then that one instance, the data happens to be reliable. So the liability for physicians and providers is quite high already. And adding unreliable data to that does not help solve the problem at all.
Gotcha. No, that's great insight there. So next question is, so curious to see how healthcare providers, organizations think about the chargeback model, reimbursement model for remote monitoring. Are tools, platforms doing anything particular to help facilitate this? Are you seeing anything?
Yeah, I mean, I think, look, yeah, I'll tell you on the payer side, I mean, a lot of times payers get a really bad rap because they're looked at as somebody that's just trying to not pay out claims. But the reality is that the payers have just as much equity in better health outcomes as anybody else does, right? And from their standpoint, they're not looking at every one of these activities to say, is this going to be a profit-making, event or not? I think payers are just as interested as providers in most cases in making sure that there are less readmissions, that people don't go to the ER. Because not only is that just bad patient experience, it does have a cost element. So if they can do something to reduce those kind of outcomes, I think they're aligned to the right platform, the right technology that helps them solve that problem.
Thanks, Fuad. And I think we got one more question before we wrap up here. But as the chief data officer, you were managing a lot of data coming in and coming out. I imagine with RPM and telemedicine, more data is going to be sitting up there in the cloud, for, large organizations like yourself, like, with big pharma or hospital providers or carriers looking to rely on this type of data and hosting it. What kind of advice can you give to them, or what should they be looking out for and prepare for this?
Yeah, I think, look, I think from just as startups are sort of struggling to figure out how to penetrate some of these payers and large provider networks, I think a lot of the payers are struggling to figure out how do they manage their own data. If you sort of look at some of the larger payers in the industry today, they've been around for a long time and they have a lot of legacy technology, right? So I think, a lot of on-prem, a lot of legacy things that run on mainframes still. You'd be surprised how much mainframes still exist in the payer space specifically. So I think there's a general demand and an understanding that the way data is managed and brought in and pushed out has to change. And I think all the same technology and platforms that you're seeing non-healthcare entities leverage are going to be just as relevant for the healthcare space. So going to the cloud, having a more cloud native solution, having more integration and interoperability with a number of EMRs and other, other platforms that play a role, I think is going to be continuously critical. And then I know I mentioned it a couple of times. I think this interoperability regulation, which sort of takes the patient record away from one EMR and from a jurisdiction of one hospital or one provider to a point where it's going to be sort of freed up and owned and moved with the patient as they go from one to the other. I think that's going to drive a tremendous amount of innovation. And that's going to start with getting off of some of these legacy systems, going to more cloud-first technologies, going towards more, real-time things versus kind of events where things happen and are updated on a periodic fashion. So I think all the trends you see in general enterprise are happening in healthcare. They're just happening from a slightly different lens. And that's what I see so far.
Wow. Well, thanks so much again for all the insights and knowledge you shared with us today, Fawad. This wraps up our fireside chat